So with a patient with autism, it's recommended to schedule the appointment the same time of day, use the same operatory and the same staff in order to allow the patient time to become familiar with the office. It's also recommended to schedule a desensitization appointment. At this appointment, there is no actual dental work being done. It is simply just to get the patient comfortable in the chair. The light is out of the way, the instruments are out of sight, and the patient is left with personal space in the chair just to become comfortable. This may take more than one appointment. If the patient is not comfortable after the first few moments in the chair, the patient can be dismissed and come back a week later to try again. At the second appointment, if the patient's more comfortable, the clinician can then lower the patient in the chair They're not pre-programmed anymore. And begin another process of desensitization, getting the patient used to having its face touched, as some children with autism are really sensitive to touch. Further steps could be including the light and the mouth mirror until the patient is comfortable with having another person in its mouth. It's recommended to use a toothbrush initially because it's something familiar. So to bring the toothbrush into the patient's mouth and just brush the teeth. And after this is established, it will probably be possible to finish the cleaning. It is also recommended with pediatric patients to allow them to bring something that is comforting to them, such as a small blanket or a teddy bear. They may also benefit from having a distraction mechanism like music or headphones. Another anti-anxiety technique would be to use the lead apron. If this method fails, there are other measures that can be taken. Prescription medication for anxiety can be prescribed, and if none of these methods work, then general anesthesia is recommended.